Okay, I have my patient here with me today, and we just went through some treatment and we found out that she has stage 3C periodontal disease, so it's at a very fast rate. And we found some 4 to 6 millimeter pockets and some 7 millimeter pockets. So that means that you're having some areas of bone loss, and we are concerned about potential of you losing some teeth. And then you also stated that you smoke. So about how many packs a day do you smoke?
About 2.
2. Okay. So that we would like to talk about. Just cutting back on that nicotine and tobacco use, because that can, since you're at a grade C, it's really progressing really fast, so that bone loss is rapidly deteriorating. So what we want to do is propose some treatment to get you in for some cleanings and help you with your stop smoking, so we can get your bone level to maintain itself, and that way you don't lose any teeth. So we have this decision guide here for you. So some of the questions that people ask frequently are, what does the treatment involve? And these are appear if you choose to do no treatment, or if you just want to do self-care, professional treatment, if you would like some local anesthetic during a procedure, and then we'll help you to quit your smoking habit, and then what it means to keep up with your care with us. So you also stated that you don't have dental insurance, which I know is a big concern, because the doctor said that you're going to need some extensive scaling and root planing. So that just means that in those areas with the deep pocketing and you have heavy buildup, since it's been a while since you've been into the dentist, we're going to need some time, probably to do one appointment to do half of your mouth, and then you'll probably have to come in again and do the other half, because with those deep pockets you might have some areas of sensitivity, and some local anesthetic of numbing would be needed to make you comfortable. Do you have any questions up to this point with any of the procedure?
Not yet.
Okay. So then one of the other questions, what are the benefits of choosing treatment, professional treatment? We can gain control of your disease, and that way your bone level will stop deteriorating or improve itself. Those pocket depths will always pretty much be around the 4 to 6 and 7 millimeters, but they won't get any worse if you continue care with us. And then so once we get your care stabilized, you're going to need frequent maintenance care. So that means you need to come in every 3 to 4 months, so that we can make sure that everything is healing properly and staying healthy. Oh my gosh. Okay. And then, so another question is, what happens if you decide not to have this treatment? So if you continue smoking 2 packs a day, then your case will definitely get worse, and you will definitely lose teeth, since you are progressing so rapidly. So we don't want you to get to that point where you're going to eventually need implants or possibly need dentures, because then that will be at a greater expense. Yes, so an SRP is maybe a few $1,000s at the beginning, but if we do this initial treatment and then you come in every 4 to 6 months or every 3 to 4 months, then that will help, where you're not paying thousands of dollars for implants or dentures. So the effects of this treatment, if you get no treatment, I already stated that it'll become worse. But if you get professional treatment, then we can get all that debridement or all that calculus and all that away from your teeth. And sometimes, since you have some deep pocket depths in your anterior and your lower, sometimes it can cause mobility. So that hard deposit on your tooth could be holding your tooth in place right now. But once that's removed, sometimes it will cause a little bit of mobility. It's rare, but it can happen. It just depends on your disease progression.
Will it go back to being stable?
Sometimes it does, but then there's other times it doesn't. But we would like to get you in, get that debridement, but with that healing process, and that sometimes that will make it where it's not, your tooth isn't mobile and falling out. But if you continue to smoke and not come in for treatments, then it will get mobile and eventually you'll lose it. So there's no risk in stopping smoking, so that we really should work on cutting back. Maybe let's try doing, instead of 2 packs, a pack and a half, then down to a pack, then a half a pack. And then that way we can slowly break you off of the habit instead of just going cold turkey, because that will tend to lead to people just picking back up the habit. So another question people ask is how this treatment will impact their ability to work. So if you choose no treatment, of course there's going to be no impact because you're not missing work to come see us. But with professional treatment, you might need multiple longer appointments, so you can you might have to miss a few days of work or an hour or two there during your work day. With local anesthetic, if you do need to be numb, one half of your mouth might be numb when you do go back to work, but it's okay to return to work that same day and it will wear off during the day. And then with follow-up appointments, you might need a 30-minute to an hour appointment depending on your stabilization. And so you might have to miss work once every 3 to 4 months. And some people ask if there's other treatment options, and I would say there isn't really any other treatment options because we really do need to remove that calculus and get your mouth healthy again. But we may need to give you some antibiotics or chlorhexidine mouth rinse to rinse with to help the healing process. So any questions with your treatment that we've proposed for you?
No, I think you've covered everything.
Okay, thank you.